Caring for a loved one who is ill or disabled can be taxing. That goes for those providing care to the more than 5 million Americans currently living with heart failure. New data and technology being presented at the AHA scientific sessions is about to change how patients care for themselves. Joining us today, Dr. Philip Adamson. Good morning, doctor.
Good morning.
I've been related to a few of these millions of Americans living with heart failure. What is the impact on caregivers?
This disease is a very symptomatic disease, and it affects well over 5.5 million patients in the country. The symptoms are really related to excess fluid in the body. That leads to shortness of breath, swelling, and tremendous anxiety. It's as if you're drowning in your own juices, and that affects both the patient as well as the providers.
Why do heart failure patients find themselves in the hospital so often?
This syndrome stimulates the body to accumulate fluid from both outside the body as well as inside the body, and that fluid buildup leads to symptoms that can't be controlled with pills by mouth. So patients many times have to urgently or emergently come to the hospital to be treated with intravenous medications to remove the fluid, to get the fluid out of their blood vessels and alleviate the symptoms. Tremendous burden for caregivers, tremendous burdens for patients, decreases quality of life, and almost sometimes produces a hopeless situation for the patient.
Of course, I'm thinking about the people I care about, my grandmother, my father-in-law. So what can we do for families just like mine so that patients are spending more time at home and less time in the hospital while still being accountable to and having a healthy relationship with their doctors?
It is amazing how many patients or how many people we know that have heart failure. What we've done over the years is try to identify what we could monitor to decrease the chances that a patient would accumulate this fluid that leads to symptoms. And what we've done in the last couple of years is develop a sensor technology. Now this is a totally implanted tiny wafer disc sensor that's implanted inside one of the body's arteries. It doesn't have a battery, it doesn't have a lead, it's empowered by external interrogation. So patients are able to lie down on an antenna. That antenna talks to the device and then sends the information over the internet to a website that providers, healthcare providers, can look at to manage medications.
So this antenna, is it something the patient keeps at home and then the data goes on a somewhat regular basis back to the doctor's office?
Exactly. We actually did that every day. The patients uploaded information from their homes every day and then utilized that information to really produce the most personalized medicine that we could to tailor medical therapy for that individual patient. And what we found when we did that is that we reduced dramatically the need for hospitalizations in the population. And what we reported yesterday was really focusing on the elderly population who really have a significant amount of this disease process in that population.
So the big picture here, it's about the frequency of hospitalization, but could this also speak to quality of life for patients and their caregivers? Absolutely, and you're exactly right. It's not just the patients that are affected by this syndrome. It's their caregivers and their extended family. It's a tremendous burden, both financially as well as quality of life on the patient. So this technology promises to keep patients at home, decrease the need for hospitalizations by stabilizing their syndrome, keeping them from getting sick, and actually making them feel better over time. We are out of time, but is there a website where our viewers can go and learn a little bit more themselves and then maybe put a list of questions together to take to their own cardiologist? What's the site?
There's a website called heartfailureanswers.com. Heartfailureanswers.com. Patients can find information and find the local provider that is utilizing this technology in heart failure management.
Perfect. Dr. Adamson, thanks for joining us today.
Thank you for having me.
Thank you. Mike?